Good afternoon, everybody. Thank you all for being here with us at MedAxiom's Fall Conference. And today you're going to be listening to a great presentation called Your Data, Your Journey, the Value of Data Migration and Integration. Today's presentation is sponsored by one of our long-term partners, Merge, and they've been with us for many, many years, so appreciate them sponsoring with us. Today's speakers will be Chanel Swartz. She is the Vice President of Value-Based Care Operations for U.S. Heart and Vascular, also one of our partners. And Christy Bricker. She's the Vice President of Strategic Services for Merge. So with that, I'll turn it over, and the floor is yours. So welcome.
Thank you, everyone.
Oh, is it on? It's on.
Now it's working. Thank you, everyone, for joining us today. Chanel and I are going to give you some insight into how we, along with our esteemed colleagues, were able to launch and migrate and integrate over 15 cardiovascular clinics, which equated to 35,000 patients over the course of 7 months. And we did that into, of course, the Merge platform. But we couldn't have done that without the help of a couple of our esteemed project managers. And project managers, of course, help us keep everything on track as we were able to do this over the course of those 7 months. So with that, I'd like to introduce Chanel and have Chanel give some background as to the why Merge, why she chose to bring everything into this one single platform, and why having it all into a platform that enabled for the discrete data was so important to her and to U.S. Heart and Vascular.
Thanks, Christy. Thanks for having me here. It's nice to see everyone. So let me tell you a little bit about U.S. Heart and Vascular for those of you that may not know. U.S. Heart and Vascular is a physician practice management company, an MSO model, and we have acquired and partnered with cardiovascular practices in 5 states and counting, and we have 15 practices. It might even be 16, but we'll say 15.
I think you're right.
We're growing.
I think we did onboard an additional one, yeah.
So we're in 5 states. We have spent this last year really unifying our platform and leveraging technological solutions to kind of bring everyone together. So not only did we push everyone over to Merge as our CID monitoring platform, but we also got everyone onto one instance of an electronic health record, one instance of a PACS system, HRIS systems. Been very strategic about which strategic partners we leverage for our vended solutions. And so it really, we feel, adds to improving the value and the creation of us as a platform. So going to Merge was really important. Mm-hmm. We picked Merge. One of our legacy practices, HeartPlace, had been on Merge for a couple of years and had seen a lot of success in improved clinical outcomes for their patients, include improved data collection and improved compliance on what they were doing. And so when the platform, obviously we did an RFI process, we evaluated all sorts of different vendors before we came up with our solution of Merge, but Merge was the leader for us, and we're happy to have gotten here. And so we, I just want to make sure I'm following. Am I still on track?
Yes. So let's, so as we talk about that, let's talk about some of the things that as we were doing the migration over from after you selected Merge as your vendor of choice and your journey, you know, U.S. HeartPlace was already on Merge, but we had all those other clinics that we needed to migrate over, yep. Right? So yeah. You had different scenarios. You had some that didn't have a platform.
Correct.
You had some that had multiple different platforms, and we had to go through each and every one of those to decide what is it that we're going to do? What is the data that we need to bring over? How are we going to migrate? So we brought some over without, and we had that EHR.
And the EHR conversion in there at the same time.
All at the same time. So we had so many different moving parts, right? So we brought some on that didn't have an EHR integration.
Correct.
And then we timed others with an EHR integration. We had some that were not on a CIED platform. We had others that did, and you had to stage all of that based on contract ending dates. What is the plan from a rollout standpoint based on, system-wide dates, right, that we're rolling out. And then we started looking at what is the required discrete data that this CV service line wanted. What was available with each one of those CID prior systems that you had?
So I think we were very strategic and thoughtful,
Yes, you
together.
were.
I say we.
Yeah,
it was a partnership.
We actually did start to think we were working, partner there
That's right.
for a while. Yeah.
In terms of who we staging that migration because we had all those other things going on, and so we really mapped that out. Really nicely. And then, yes, it was complex to bring in all those different contract ending dates, what commitments we had to other vendors, who was really ready to flip, who was ready to, what kind of staffing some of these clinics had to be able to, especially if they were going from a fully vended solution.
Correct.
And so there was a lot of things to take into consideration there. I think, and that's kind of back to the beginning when we were like, we could not have done this without our project managers.
Yes.
Bless Joey and Diana. They were amazing in keeping us on track and organized. And then we also had really engaged operators in the markets who were really excited to come onto the platform, especially to your point, we had people who had like spreadsheets, right? Who had spreadsheets of patients they were trying to track to keep in mind, like which vendor's portal they were going into. And so there was a lot of, as far as what we were looking to see, the improved compliance of the intervals, tracking of our patients, making sure that we weren't losing patients to follow up. And so there was a lot of information that was critical of why we wanted to even be on a singular platform like that.
Absolutely, absolutely. And then as we were looking at that, from the disparate systems that you all had, we got in there and we started seeing, okay, what data is available at each one of these disparate systems? What data is available from a discrete level standpoint? And then we would partner with the clinicians and say, what is the data that you all need? What is available discretely? And then we would ingest that data into Merge for you all, so that they could have it to keep going from a clinical standpoint, right?
Yep.
Because research, we all know how big research is today, right? Ensuring that they could have all of this from a research standpoint, because they had it prior. We need to make sure they're going to have it going forward, right? We don't want to lose anything, but we also don't want to replicate anything that was going to be migrated over from one EHR system into another, because we don't want to send duplicative data over, especially not in, bog down a new EHR system out of the gate. Being someone in IT, I of all people appreciate that, right? But so that they can make those clinical decisions as they're, coming onto a new platform and have that. And then we also worked heavily with the IT teams to say, okay, we need to build out this new platform. What is the key discrete data that we need to ensure we're standing up a platform for your clinical team in being able to set them up for success? Right? So we would look at ensuring that we have MRN, date of birth, date of service, so you didn't lose any billing intervals as well, which was very key. And to your point, you had some clinics that were managing based off of spreadsheets.
Yes.
We all hate that, right? We all wish we could, not have a spreadsheet anymore. And then have others that, were doing billing out of disparate systems as well. So, we definitely had our challenges in front of us.
It's, I have to say, working with Merge, you guys have been very responsive to, for those of you who may not have experience with Merge, there's a lot of data analytics that is really, for me, the VBC nerd that I am from a population health perspective, you can't do population health without data. And so I really love how Merge has this analytics portal. But on top of that, I've come to you guys with like, hey, can you add this particular field? Can you roll this up in such a way? Hey, I actually need to be able to track this thing. And you guys have been very responsive to like, let me see what I can do. Let's see how we can give you that information. So like the IDN reporting, level reporting has just been amazing. And Alicia and team have been like, oh, I think we can actually add that field here. Oh, I could see why you'd want to track that. And so I think from, a population health standpoint, having that data, as well as like obviously Merge helps with billing and compliance and tracking your patients, but there's a lot of good information in there, just even from like a cohorting population health management perspective that has been crucial.
Yeah, and you're spot on with that, right? Because we provide reporting down at the clinic level, but for your situation, you know, from where you sit in the organization, you can look at it at an IDN level and know exactly what's going on. And, you know, you mentioned earlier, you know, you're working with Erica and so forth. From an account management standpoint, she can provide you that reporting that'll show you everything that's going on and roll it all the way up to the whole IDN.
Yeah.
And look at the compliance across all of U.S. Heart and Vascular, or break it down by clinic, right? Which is important. You need to know where
So
you stand.
important.
Exactly.
I'm not gonna call them out because I don't want to throw any of our practices under the bus. But we have one practice that's going on. We've discovered that there's like 1,500 patients that have been like lost to follow up because of their manual process. And so they're going in and right now cleaning up their roster in their Merge in terms of, is this still an active patient of ours? Have they actually moved on and gotten care somewhere else? And we would never have been able to do that without going onto a platform like this.
Right. And that's where that discrete data coming in is so valuable, right? That data is your data from those other prior systems, right? Any way you shake it, that is your data to ingest in, and discrete data is the only way to go, right? You can't get that data from a PDF or anything else, right? You have to start from true discrete data coming in.
Yeah, from, you know, a population health perspective, you have to have the ability to have tables and tables of data that you can slice and dice in whatever way that you need to in order to be able to develop new models of care, figure out what interventions your patients need based on what's going with them. And so you can't do that without discrete data.
Absolutely, absolutely. And then to your point, also with that on the, you know, the loss to follow-up, you know, you all have also done a tremendous job of starting to roll out patient reminders that we have now, right?
Yep.
Which is an enormous feat, and it takes it off your clinic staff, right? To where you are able to send out text reminders to your non-wireless patients to say, hey, it's time to send a transmission in, because, you know, it helps a lot, and that's also helping to break down some of those that are not transmitting in.
Yeah, and you know, that text message feature, when you think about the average age of our patient populations, you know, their digital literacy varies, right?
Varies,
and
yes,
so
it does,
having
doesn't it?
something easy like a text message where they can just click on it, you know, if you think about it, patients don't really want to go into portals. They don't want to log into another system. And so
No.
having things like a text message where they can just click something, or like, oh, that's a great reminder, I need to do this now, makes it really easy for them. And even if I had like surplus of staff, which I don't have, calling people, patients aren't picking up the phone either. And so I love that particular feacher of what you guys have.
And to your point, I don't know of any healthcare system that has a surplus of staff right now. If they do, I mean, I think we would all like to know where they're at, right?
Sure.
Somebody's hiding them for certain.
Sure.
But yeah, and then the other thing that you guys have rolled out is you all have utilized some of our services feature or functionality department that we have right now, and you're looking to centralize.
Correct.
And stand up like a centralized hub, which, you know, the platform is great for that, because you can share access to look at that. And you're also working with our VP of Clinical Services and Director of Clinical Services on the Empower program that we have, which would allow you to train staff at the ATI level as far as to ensure that they're properly trained and ready to go from a clinical acumen.
Yeah. So like I said, 15 legacy organizations,
Right.
they all were doing something a little bit differently. I would say at least a third of them were using totally vended solutions. So
Right.
they didn't really have any staff anyone on staff doing the monitoring for them. And we appreciate that Merge has their on-tap service, but that's not really the business you guys all want to be in. You have it there as sort of like, hey, we'll be a great partner and make sure your patients are taken care of, but you really long-term need to find a solution for yourself.
Right.
And so we will be centralizing CIED monitoring, starting with those practices that are utilizing your guys' on-tap services. So we'll be building that out over the next year. And, you know, that's the beauty of joining a platform like this and getting everyone onto singular systems is we can centralize, we can have economies of scale, we can become really efficient, and really, have a team that is the SME of what they need to be. And it allows us to, let's think about it, a small clinic, you might have someone on staff who's doing monitoring for your 500 patients, but they're probably doing 4 other things too.
Right.
And so if I can take that allows that staff member then to focus on something else in the clinic rather than trying to log in and monitor all these things.
Absolutely, absolutely. And then, of course, we celebrate when a clinic takes it back over, right? To us, that is just a beautiful day for us, right? We want you all to be able to self-monitor, right? And centralize and keep all of this in-house, right?
Yeah.
The platform was built and designed for just that,
Yeah.
right? To be able to do all of that on your own.
And it's just great that you have a program which will help us, scale up the talent, train the
Yes.
talent across the platform.
Across the platform,
Yeah.
yes, absolutely, absolutely. Well, and as we're wrapping all this back up, just to hit back on that data, right? The data is so important, as we keep talking about that, because more and more things are moving towards that discrete data, right? As we were talking just outside earlier, right? There's more going towards discrete data, and we're looking at more and more into research and physicians wanting to know and being able to map out and wanting to do collaborations and wanting to know, how do I look at this cohort of patients? Like I said, we were just literally sitting out front and talking about this. But unless they have that discrete data and can look at a certain cohort of population of patients, how do we really go at that, Chanel? Because you were talking about it from a value-based care center, right? Population
absolutely.
health. So how do we,
and so, for us in ingesting this data from platforms like Merge or electronic health records or payer partners and aggregating that data, I mean, we use Snowflake. We have a data lake. We aggregate. We're able to then create dashboards that can slice and dice and drill down into things. It's crucial to what we're doing here at U.S. Heart and Vascular, whether not even just from a value-based care perspective, but just in terms of really great patient care, right? We want to drive, high quality outcomes. We want to be able to decrease the debt burden to the healthcare system and do interventions, more upstream. And so having platforms like Merge and other things that we have at U.S. Heart and Vascular really does help us be able to pinpoint that data. Scanning a PDF into a system's not going to help me.
That is true. That is true. That's one of the things that we also, we pride ourselves on, because we're doing more and more with discrete data as well, right? Because we know healthcare systems need more data to look at it. We're working more with healthcare systems like yourself to pull in, like, just discharge data, to have it available.
You and I have been talking about that.
We've been talking
yes.
about that,
yes.
right? Because you all are so focused on when was the last time the patient was in the hospital. We need to make sure it's within that readmission time frame, right? I always, just for those that don't know, little Susie's always my little patient, but just so little Susie wasn't just in the hospital, right? What is the EF? What is their CHA2DS2-VAD score? Just to get that full view from a cardiovascular standpoint, right? To have that true vision of what's going on. Because a lot of the EHRs can't build out a CV dashboard for the patient.
Correct.
Right. I mean,
Correct.
yeah, we both have seen that in our tenure, right? And
Yeah.
so we're trying to help you all so that you will have it, and then you can use that data that you can get out of Merge, and then bring it into a data lake or yourself, and then combine it.
Yep.
All right. Well, thanks. Just in summary, if there's any questions, we can be reached either right outside after today. But thank you all for joining us today and listening to us talk about our journey together as we brought U.S. Heart and Vascular on to the Merge platform. And if there's any questions, we're happy to.
I think there's Q&A now, right? Is that
I think so. Yeah.
If there's
I think there's
questions,
supposed to be Q&A now. If anyone has any questions,
they told us to save time for Q&A.
Yeah, they. If not, Chanel and I can sit up here and talk all day.
All right. It's the post-lunch coma.
I
That's
know,
what's
it
going
is,
on.
yeah.
That's what's going on. Okay, thanks you guys so much for joining us today.